Health, Psychology, and Human Nature with André Sturesson. Hey friends, hope you're having a great day. Are you following me on Instagram and Facebook? Please go to Health, Psychology, and Human Nature on Instagram or Facebook, or both for that matter, to get the latest episodes, inspiration, and more. Please take a pause and go there. Also, if you like the episode, please share it with a friend, family member, or somebody else who you think might like it. Welcome back, friends, to Health, Psychology, and Human Nature with André Sturesson. It's a science-focused podcast where we explore, learn, and improve our lives together. Omega-3 seems to be one of the best supplements when it comes to health. And it's also one of the most studied compounds in biology. In today's episode, we discuss how omega-3 affect the heart, mental health, babies, and even sperm. We also discuss how much omega-3 you need, supplements and dietary sources, and how to measure your omega-3 levels. Today I talk with both Dr. Bill Harris and Dr. Kristina Harris Jackson. Bill is an internationally recognized expert on omega-3 fatty acids and especially how they can benefit patients with heart disease. Bill have studied omega-3s since the 1980s, so before I was born. Dr. Kristina Harris Jackson has a PhD in Nutritional Sciences with a particular focus on how omega-3s affect pregnant women and babies. I really hope you enjoy this interesting episode. Bill and Kristina, welcome to the show.
Thanks.
Thank you.
It's a real pleasure having you on. I think it's going to be a really interesting conversation because we're going to talk about something very, very interesting, omega-3.
Oh, yes.
I opened up an omega-3 capsule yesterday because I went to your blog on Omega Quant, and then I saw a blog post where it said that you're supposed to check your omega-3 supplements by opening it up and smelling them.
Oh.
So I actually did that yesterday. So I got fish on my hands and everywhere. So I got that like on me for the entire day.
I'm not sure we should be recommending that.
Yeah, it was in like the myths of omega-3s. It was something about, maybe we can just start with that just before we head on further. It was in the post there. It was said that omega-3 supplements are not supposed to smell bad when you open them up. Is that true?
It depends on your definition of bad.
Yeah.
Because even the most highly purified ones will have at least a slightly fishy smell to them. They all come from fish. I think even the algal ones, the ones that come from algae, you'll have a little smell. So if you're used to drinking cod liver oil every day, they don't smell at all.
Yeah.
But yeah, you're not going to find any fish oil that has zero smell.
That's good. Then my supplements perhaps is fine then. Hopefully.
It's probably fine. We don't recommend that people actually chew their supplements. That would be a bad idea.
Yeah.
So anyway.
Yeah. All right. Okay. I thought that if we perhaps could start off by if you could just in short explain, like if I just ask you what omega-3 is, what do you say then? What is omega-3?
Omega-3s are a type of fat, a type of polyunsaturated fatty acid. And the omega-3s, there are kind of two kinds. There's what we call the plant-based, and then there's the marine-based. And what we mostly study and focus on is the marine-based, and those are eicosapentaenoic acid and docosahexaenoic acid, normally called EPA and DHA. The other kind, the plant-based, that is typically known about is ALA, alpha-linolenic acid. And they're related, but our bodies can take ALA and make EPA and DHA from that. It's just not a very efficient process. And so a lot of the research is on EPA and DHA when you're looking at omega-3s, and a lot of the health benefits are related to those two, more so than the ALA. And so they're fats in fish that have a lot of effects on our bodies.
Right. And when it comes to the three of them, DHA, EPA, and ALA, so what you mentioned there is that it's DHA and EPA that we get from fatty fish, and ALA is something that we don't really get from fatty fish in the same amount, right? And it's the EPA and the DHA that seems to be the important ones for a lot of different health measures.
Yeah, the ALA is what you'll get in walnuts and flaxseed, and it'll be advertised often as like good sources of omega-3s, and it gets confusing because those are very different sources than the fish-based sources. So they're technically all omega-3s, but the ones that really have the bulk of the research behind them is the EPA and DHA side of that. ALA still has good effects, and it's a healthy thing to have. It's the essential omega-3 fatty acid. We have to have it in our diet. But as far as the effects on heart disease, brain health, pregnancy, we're really focused on the long chain omega-3s, the EPA and DHA.
Yeah, exactly. I think that is a very important point, because like I bought this chia seeds here, for example, and it says omega-3 on the package, but then that kind of omega-3, it's not like the DHA or the EPA. So I think it's a very important point.
Right. Chia's great. I put it in my smoothies. I just don't expect to get EPA and DHA from it.
yeah, exactly.
Yeah.
Interesting. And I thought that today that we're going to head into a lot of different areas when it comes to omega-3s, EPA and DHA, and the benefits of them. And I thought that I start by asking you guys, so what do you think, like what are the best, where have we seen the best positive effects from EPA and DHA?
Probably heart disease is where the whole story started. That is to say, higher levels of EPA and DHA in the diet, in the blood, are always associated with better heart health. And that began back in the 1970s with studies in Greenland Eskimos. And it's continued ever since. So, I mean, that's where you see the benefit. We've also seen benefit in terms of cognitive health, brain health. There's the evidence is not nearly as strong because there's not as much of it for a benefit of omega-3 in brain health, but it's accumulating. It's a growing field of research interest. So we think that higher omega-3, basically what's good for the heart is good for the brain. It's the simple way of saying it.
Right, interesting. So the heart has been the thing that has been mostly studied. What effects does the EPA and DHA have on the heart?
Well, we look at a couple of different kinds of things. First of all, we look at the effects of omega-3 on what we call heart risk factors, heart disease risk factors. And a risk factor is something like blood pressure. High blood pressure is a risk factor for heart disease. So does omega-3 affect blood pressure? Yes, it does. It reduces blood pressure when taken in pretty good sized doses. There's a lipid or a fat in the blood called triglycerides that's always measured in most when you go to the doctor. And the triglyceride level is kind of a partner with cholesterol levels. They're both lipids in the blood. But the triglyceride is a thing that if it's too high, that increases risk for heart disease, and omega-3s are very effective at lowering triglycerides. So those are a couple of things where the omega-3s affect the risk factor for heart disease. But the most important thing is where omega-3s actually, when they're given to people, they actually reduce their risk for heart attacks. And that's been shown in several studies now that you get a statistically significantly lower risk for heart attack or fatal heart attack when you're higher in omega-3.
That is, I think that is very, very interesting. Like, how big are the effects? What have the studies shown?
Yeah, so the biggest study, the most recent study was a study called VITAL, VITAL, and it was a study in about 26,000 people in the United States who were given either a placebo or, a sugar pill. And it wasn't sugar.
Yeah.
It was a pill that looked like fish oil, but it wasn't. It was like a vegetable oil. So that's the placebo, the inactive thing. And then they were given about a little less than 1,000 milligrams of EPA and DHA, the two omega-3s that are active. And they found about a 20% reduction in risk for heart attacks in that study. So, considering these were relatively young people who didn't really have big high risk for heart disease, there were not a lot of heart attacks in this group, maybe 200 or 300, and they were reduced. The risk for having one was reduced by about 20%. So that's good. That's substantial.
20%, that's really a lot. How old were they again? So, did you say?
They're probably 60 on average, roughly.
Right. 20%, that is quite a lot.
Yeah, not for a period of around 5 years.
Yeah.
Yeah, it's a whole different thing to start taking an omega-3 pill when you're 60 and hope to have a good impact on you, compared to taking omega-3 from the time you're 10 or 0.
Yeah, for sure.
So there's a different kinds of studies. There's studies where they divide people into two groups and give one group fish oil and the other group some kind of inactive pill, and see what happens over the next few years. And then those are good studies, but they don't answer all the questions. The other studies are ones where you measure blood level in people and follow them for 30 years and ask if the higher blood level is associated with a better health over that period of time. So we do both of those kinds of studies here. And in both cases, higher omega-3 is beneficial.
And when it comes to the heart, is it the DHA or the EPA or both that are important?
We don't know for sure. We think both of them are important. They're both always found in fish oils naturally, and so when you eat fish, you're getting both of them. There have been studies done when you give EPA and DHA, and it does benefit heart health. And there's studies done when you give just EPA. That benefits heart health too. So what we don't know is if just taking DHA alone benefits heart health. Nobody's done that study, so we can't say. But our view is that both of them are important for heart health, brain health, health across the board, except for probably Kristina's about getting ready to say in the prenatal world for babies. Yeah. I'm not sure you want to go there yet.
Yeah. I think we'll get into that in a little bit. Okay, so it's we don't really know if it's like the amount of DHA compared to the amount of EPA when it comes to the heart. Then,
well, we know how much EPA and DHA is typically in the heart and in other cells. We don't know which one is most important for improving heart health.
Okay, all right. So when it comes to if you would like to affect your heart and reduce your risk of having a heart attack, what would you suggest the levels of EPA the amount of EPA and DHA in a supplement, for example?
I would aim for something in the 1 to 2 grams, 1,000 to 2,000 milligrams of EPA and DHA.
Right.
I think that's a good area. That's very doable. It's not expensive, and that will help raise your blood omega-3, your omega-3 index, which we'll probably talk about a little bit later. It'll raise your omega-3 index up into a healthy zone.
Right.
I would also just add on to that. We think the best way to figure out your dose is to test your omega-3 index and then tailor your dose to that. So people that are in Scandinavia typically eat more fish and have higher blood levels than people in America. And so you might not need as big of a dose in a supplement as someone who doesn't eat any fish. We pretty much know that.
Yeah, right.
So that's where the testing comes into play, is that you can figure out, I mean, you might be fine just with your dietary sources. If you're eating fish every day, every other day, then that works. That can get you into the 8 to 12% range for the omega-3 index, which is our target range.
Right. Yeah, I saw that on your map on your webpage that Sweden was one of the few countries that were actually pretty good when it came to the levels of the omega-3 index.
Oh yeah, it tracks with cultures that eat fish on a regular basis, especially the oily fish up in the cold waters.
So what was also very interesting when I was looking at your blog post, where you had a blog post about omega-3s and mental health. So I thought if we could talk a little bit about that as well.
Sure.
Yeah. So maybe we could start off by talking about depression. Because it seems like there are some contradictory evidence there.
Oh, well, I mean, just to back up, yeah, there's contradictory evidence everywhere.
Yeah, yeah.
I mean, one of the, I think, little known facts is that omega-3 fatty acids are one of the top 5 researched, molecules in biology. If you look, and there's so many studies on omega-3. There are over 40,000 different studies on omega-3, and there's over 4,000 human clinical trials where they actually study. So when you have that much data, you can find exceptions to the rule everywhere, because there's always something. But by and large, the studies that have been done in depression, we've done studies where we measured omega-3 levels in blood of depressed and non-depressed people. And we find that people who are depressed have lower omega-3.
Yeah.
Okay. Now, that doesn't mean necessarily that the low omega-3 is causing the depression. There's a thing in research called reverse causation, where you could observe what we did, low omega-3 in people who are depressed, and it could be because depressed people don't like fish.
Right.
So that's the reverse, right? So that's where you have to look at other kinds of evidence. And so when people have taken a group of depressed people and given them omega-3 or a placebo, inactive, and then look months or years later to see how their depression symptoms were, by and large, those studies will find a benefit of the omega-3, giving omega-3.
Interesting. So how much is typically in these studies? How much do they typically eat in these studies?
How much are they given?
Yeah.
Probably in the neighborhood of 1 to 2 grams, maybe.
Okay.
And that's the thing. And what's interesting, back to your question about EPA versus DHA.
Yeah.
In the area of depression is probably an area where we would say EPA may be more important, because the studies that have been done with EPA-rich products, meaning there's more EPA, significantly more EPA than DHA, those tend to produce benefit more so than studies that have DHA-rich products.
Right.
Kind of our assumption at this point that for depression, you need to take more EPA.
That is very interesting. And with these studies, like how big usually are the effects? Are there any study that looks at the effect sizes of their reduced symptoms?
Yeah. Yeah, they do look at those. I guess you wouldn't say that omega-3s are as good as a drug for depression.
Yeah.
They're not that big an effect size. Again, we got to remember these are nutrients. They're not drugs. They have, the upside of that is they have no side effects.
Right.
The drugs do. So basically what we think is going on is that a higher omega-3 in the diet and the blood and the tissues just reduces your risk for depression, reduces the severity of depression, but it doesn't cure depression.
Right.
It's not a silver bullet in that sense.
So it's something that seems to be good to to take to prevent depression?
Right.
then?
It's just kind of it's not the only factor, obviously, in depression or in heart disease, for that matter. It's not the only factor, but it is something you can do something about.
Right. Yeah. I mean, it's very interesting that a supplement actually has been shown to have effects
Right.
at all. I think
Good point.
So you probably know, or you do probably know a lot more than me about this, but I guess that there's not a lot of supplements out there where there has been an effect shown in a lot of different studies.
Right. Dietary supplements have not been well studied, not with the rigor of drug studies. And a lot of that is because a lot of the trouble with studying nutrition is, whereas in a drug study, you can give half the people the drug and the other people don't have any of the drug in their blood, right? They don't. But with nutrition, everybody's got all the nutrients in their blood already. It's just a matter of higher versus lower levels. So it's harder to find effects when you're looking in that situation. A lot versus zero is easier to see an effect than just some versus more.
Right.
That plagues the whole nutrition research field. But omega-3 is distinct because most people have very low levels of omega-3, and it's easy to give them in fish oil supplements a pretty good dose. So you can really expend the difference between the people who are low and the people that are high. So,
and in there's a ton of research done in Scandinavia, and in populations that already have relatively high blood levels, they can still give a higher dose on top of that and continue to see effects. So it's interesting that it works still in high fish intake places.
For sure, yeah. I was also thinking about anxiety. Also, like how does the omega-3s affect anxiety?
Well, they kind of the same story, although it's not been studied as much as depression or dementia. But again, higher intakes, higher levels associated with lower anxiety scores. The question of how does this work? I mean, from a mechanism point of view, we don't know, other than to say sort of a blanket excuse like the omega-3s reduce inflammation. Well, that's fine. That doesn't really explain anything.
Yeah.
It's a step. I mean, it's better than just saying, well, it's just but they do have anti-inflammatory effects, and they do have effects on all the cell membranes in the body. And membranes are really, really important in cell function because they're the gatekeepers. They let stuff in, let stuff out, and if they aren't behaving properly, cells get sick.
Okay, so we know, we know from a scientific point of view that they work, but we don't really know how.
Not at the deepest levels, no.
All right. Yeah. Okay. Okay. Interesting. But it's very interesting that it works on both depression and anxiety, which that affects so many people around the world. So, and omega-3s are also such a quite cheap and seems to be quite harm-free. So
that's true.
Yeah.
That's something that people forget when they're looking at the effect size, like you were asking about what's the effect size. And yeah, you don't have necessarily a big effect size, but you don't have any risk either. So, but you do have some good evidence for benefit. It's just not going to replace, all the drugs that are needed for people who really are clinically depressed or are clinically needing anxiety treatment regimens. So,
right.
Dose is also, I think, it's a difficult part of this, because if you just take one fish oil pill a day, you don't know how much is in that pill, and you forget every other day, and you think you're taking it, your blood levels could still be quite low, and you're not really benefiting. Your body is not getting the omega-3s that it needs, so you're not experiencing the benefits, but you think you're taking it well enough. Yeah. So there's an issue there. Or if you eat fish once a week or every other week, but it's not a high omega-3 fish. There are issues, I think, with people's perception of how much they're eating or taking and what is actually in their body. And what gets in their body is what is a much stronger predictor of better health outcomes versus what they say they eat.
Yeah, which is great. That is actually the biological effect.
Right. There's definitely some psychological effect of taking something and believing it'll help you, but the biology is also important here too.
Yeah, for sure. And how about, so you Kristin, you also mentioned if you're already a healthy person, said a little bit about that. So if you're already like a healthy person, you're not depressed or you don't have anxiety or any other problems. Is that healthy person also affected positively by omega-3s?
The two examples I can think of right now are the JELIS study in Japan, where they gave a higher dose EPA to people in Japan who already have high blood levels of EPA and DHA, and even that extra dose reduced people's risk for heart attack. Mm-hmm. And then there's pregnancy studies, and in the pregnancy world, kind of the main outcome I'm looking at is preterm birth, and they did studies in, I think it was Denmark and Norway, and then all over Northern Europe, and where they gave women who already had high levels even more omega-3s during the pregnancy and saw reduced rates of preterm birth. So in those two kind of instances, you saw people who already had a healthy dose from their diet, adding more did help for those outcomes.
Maybe we should head into that field as well, because I think that is very fascinating. Like, so how does taking omega-3 or having adequate omega-3 levels when you're pregnant, how does that affect the mom and the baby?
Yeah, and it affects a lot, like with everything. It affects all parts of the body. Yeah. It gets into every cell. But the latest research has really been pointing to having higher DHA levels specifically during pregnancy reduces the risk of early preterm birth and in some instances preterm birth. And so early preterm birth is giving birth before 34 weeks gestation, and preterm birth is 37 weeks gestation, but giving birth before then. And those definitions can vary, but those are the ones that I've used and seen in the research. And so delaying birth, avoiding preterm birth and early preterm birth can resolve a whole host of issues that can occur when you have early preterm birth. It's the greatest basically risk for neonatal deaths in the U.S. for sure. And so being able to delay that and avoid preterm birth with a nutrient, I think is really exciting. Like we said, the risk is very low to adding nutrients in when you're pregnant versus drugs.
It's fascinating. And it also affects cognitive function, right?
Yeah. So a lot of the research, I think initially in pregnancy, focused on DHA and focused on brain and eye development, because DHA is so rich in brain and eye. And they were finding, I think really in the premature literature, babies who are born premature, they miss out on a lot of DHA. In the third trimester, that's when most of the DHA is transferred from mom to the fetus. And so these babies coming out earlier than that time period were having developmental delays, eye issues, and there is research in the world of giving DHA to premature babies and seeing if that helps with eye or brain development after that. But when you're looking at the field, it's a tricky thing to study brain or cognitive development and visual acuity in babies and then toddlers, because there's so many things that can be affecting those two developmental organs. So they would give DHA to typically, or fish oil to women who were pregnant, half given that, half given placebo, and then try to follow the babies as they were born, and then follow them out and see if there were differences between women who got the omega-3s and who didn't. And the literature is fairly mixed in that field when you're trying to look at the cognitive development of a baby or a toddler. And so that field is rich, but it's complicated. From all that research, they started to see the pattern of gestational period being longer in the groups that had fish oil. And just that alone could be causing an improvement in brain and eye development the longer baby is in the womb. So that area of research is interesting. And I think there's definitely a role omega-3 plays there. It's just harder to measure and harder to test than the premature question, because it's pretty obvious if a baby is born premature or not. And so it is all important. It's just what can we prove in the studies is tricky.
I saw like something that you posted about having higher levels of DHA or omega-3s during when you were pregnant affected, I think it was problem solving skills and time focusing on playing or something.
Yeah.
When the toddler was like 1 or 2 or something like that.
Yes. So there are definitely studies that have shown basically like improved focus, less hyperactivity kind of kids who were exposed to more omega-3s, DHA during pregnancy, which is kind of interesting. But there are also studies that don't show that effect.
Okay. So, yeah. As always in science.
Always. So it's there's evidence, but it's not a slam dunk. I guess that maybe is not the right term, but it's just not as clear, I think, as the prematurity data.
Okay, so the prematurity data, that's where the best, that's where we gotta have the best data.
I think so. There was a meta-analysis that came out in 2018 where they looked at 70 studies where they had given women DHA or fish oil or not. And so these were randomized control studies, and they pooled all those together and they looked at kind of basic outcomes relating to pregnancy and delivery. And in that, they found that women on the taking omega-3s or DHA during pregnancy had a reduction in risk for early preterm birth of 42%.
Wow, 42.
Yeah.
Really?
And early preterm birth is less common than preterm birth. So you have fewer examples of it, and the number, that 42% number is big, maybe because there's less cases. And premature birth rates were reduced by 10% in that group. A lot more cases there. But that shows across all kinds of studies that they did for all kinds of reasons, giving women omega-3s during pregnancy, they see this really strong effect on gestation, basically delaying it. And so, or elongating that period when baby's in the womb. And so that to me shows that's a pretty clear mechanism of how DHA is affecting mom and baby in pregnancy.
Yeah, that is really
it's
something.
Strong. Yeah.
Yeah, interesting. Cool. I also read another title of a post which said that it also seems like omega-3s can affect sperm and reproductive hormones.
Yeah.
Is that true? Could you tell me a little about that?
Well, for some reason, there's a group, a very active research group in Iran. In this question. I mean, there will be more, I'm sure, but they've looked at the effects of giving omega-3 to men who have sort of lower sperm counts or lower motility of sperm, and finding that the omega-3s improved it. There's some papers from other groups looking at couples doing in vitro fertilization and asking the question if the mom and the dad both have higher omega-3 levels, does the in vitro fertilization process, is it more likely to be successful? And there's some evidence, I mean, that this is really new stuff. There's some evidence that that's true, that they are the pregnancy rates are higher. Mm. So that could be a huge deal if there's so many people doing in vitro fertilization, that if that really plays out, then measuring omega-3 or taking omega-3 in people trying to get pregnant could become more the norm.
And sperm is also one of the richest places in the body where DHA specifically lives.
Sperm and brain and the retina of the eye.
Yeah.
Some of the highest DHA containing cells in the body.
Right. Yeah. Then it sounds very plausible. If it's the highest omega-3 containing things in the body, then it sounds very plausible that it should have an effect if you also take the supplements, if you're low in omega-3s.
Yeah, right. Yeah.
You would think. Right?
Makes some sense.
Right. Yeah. Have they done like a lot of studies, or have you seen a lot of it, or is it like a single study? Or?
Definitely an emerging field.
Yeah.
So it's kind of a stay tuned thing to see what happens.
Right. Yeah. Pretty interesting. And I'd also thought if we could talk a little bit about like cognitive function and the brain. So how does omega-3s affect the brain and cognitive function?
Well, one of the studies that we did, we looked at the size. We did two studies like this, looking at just the size of the brain by using MRI scans, this magnetic resonance imaging scans that can show you exactly how big your brain is. And of course, the older we get, the more our brains shrink. So a smaller brain is an older brain. And we found in two different groups that a higher level of the omega-3 index, again, this is the blood marker that we use for omega-3 status. So a higher omega-3 index was associated with a larger brain, or put another way, it's associated with slower brain shrinkage and slower brain aging. And one of the studies, we were able to look even at the memory center of the brain, which we call the hippocampus. It's just one of the structures inside the brain where memory is really controls memory. I'm sure there's more than just one spot, but this spot is known for it. And the hippocampus we found was also the size of the hippocampus was directly related to the level of omega-3 in the blood. So people who had higher omega-3 levels, regardless of how they got there, whether from eating fish or taking supplements or whatever, but higher blood omega-3 was associated with a bigger hippocampus, which means really at least a better potential for memory.
Right, very interesting. So it seems like the brain actually is bigger, and the hippocampus, the memory center, also seems to be bigger if we eat adequate amount of omega-3s.
Yeah, right. Now, what I wouldn't want anybody to think was if you're 60 years old today and you have been eating a typical Western diet with no fish in it, you can start now and cause your brain to heal and not shrink anymore. Start taking fish oil. I don't think that's true. I think what this means is that people who for years and years and years, maybe decades, have had higher omega-3 levels, then their brain is just shrunk more slowly because their brain is healthier. It's not going to turn around your brain size immediately by any means.
Exactly. So it's kind of the same thing as you talked about earlier with depression, that it's like a long-term thing, and it's a preventive thing,
right?
Rather than an acute
not a treatment.
And I also think it would be interesting to know why it works. So if we look at the mechanisms, you talked about inflammation before, but what are the biggest mechanisms when it comes to the omega-3s?
Yeah, it could be a couple of things. One we mentioned earlier is anti-inflammatory, because we know that a higher inflammatory state in the body, just a chronic low-level inflammation going on in the body, is bad for the heart, it's bad for the brain, it's bad for about everything. And the omega-3s, we know, lower levels of all kinds of markers of inflammation. So if there's less inflammation, that, again, is one step toward explaining the benefit. And the other thing I think that's worth mentioning, studies have shown that there's better blood flow in certain parts of the brain when you have higher omega-3 levels. And so if the blood vessels that carry the blood and the oxygen to your brain are are healthier, and they carry the blood more, carry more blood to the brain, then your brain's going to be nourished better and help. So that's another mechanism.
Okay, so those two are the probably the most important mechanisms, or at least what we know so far.
Yes, fair enough.
I was also thinking about getting enough of omega-3s. So if we would get from natural sources, what would you say, what are the best natural sources of omega-3s?
Oily fish. So those are fish found in cold waters. And that's typically salmon is the most popular one. Mackerel, herring, sardines, tuna to some extent. Those are great sources of omega-3s, and if you have mackerel on toast every day, you're probably good for your omega-3 levels. And that really is the only natural source of these long-chain omega-3s, which make it really unique compared to a lot of other nutrients that are found in several different food groups and types of food. These are really specific to these kinds of fish.
Interesting. And how does wild-caught fish compare to farmed fish, salmon, for example?
That's a great question. It's kind of a long story, but yeah, this is focused on salmon. It used to be the case that farmed salmon was fed so much marine life and so much more than wild salmon got, that they had higher levels than wild salmon of EPA and DHA.
Really?
They had higher levels of EPA and DHA because they were fed you
got to put into the little salmon pellets that they feed these salmon in the farming. Actually, I call it ranching. It's not farming. I mean, they grow it from the ground. Okay, but anyway, salmon.
Yeah.
They have to put fish oil or EPA and DHA into the pellets because that's part of what keeps the fish healthy. But because fish oil is getting so popular, the price of fish oil for aquaculture, and actually about 80% of the fish oil that's produced in the world goes to aquaculture.
Really?
20 goes to human at this point. It's the demand for omega-3 in human health is going up, so we need new sources of omega-3, but that's something else we could talk about later. Point is that because the price of fish oil, raw fish oil, has gone up, salmon producers are feeling the pinch, and they're using less fish oil and more vegetable oil in salmon feed. So that's lowering the EPA DHA content. But I think the point is it's lowering the levels in farmed salmon down to where wild salmon are.
Okay. So what you're saying basically is that if we buy farmed salmon, then we actually get DHA and EPA equivalent to wild caught salmon.
Generally speaking, I think that's a fair.
Right, yeah, it's at least at this point it seems like it's at least equal to the wild caught. There is more total fat in the farmed salmon. So a wild salmon will have they're kind of more they're leaner, and they have EPA and DHA equal to a fattier fish, EPA and DHA wise. So it's also not clear. There's not labeling typically for omega-3s. There's not testing for it. I think there should be. So you don't have a guarantee of how much EPA and DHA is in your salmon. And for the farmed, that can be a more variable number than the wild, I would say.
For listeners, the important point is, I mean, I've heard people say, farmed salmon doesn't have any omega-3 in it. That's absolutely not true. Just because humans are farming them doesn't mean that they're bad foods and they have no omega-3. That's just not true. Levels have gone down. That is true, but they haven't gone down to like a hot dog.
That's interesting. That is something that I actually thought that if you bought farmed fish, then it wouldn't contain as much omega-3 at all as wild caught.
No. It's still a good source.
Yeah, and the salmon can't make their own EPA and DHA. They have to eat it just like we do. They just have a rich diet.
Okay. So let's say you're eating salmon, for example, just for this example. How much would you need to eat per day or per week, or however you would prefer to give the example? Like, how much do you need to eat per week or per day?
We looked at this. We asked people that tested with us, that we have their blood levels. We asked them if they ate fish and if they took supplements. And we looked at about 3,500 of those people and tried to show where people's blood levels were in relation to what they said they ate at a very simple level. To have blood levels that are in the 7-8%, which is a good range, those people were eating fish on average 3 or more times a week.
Okay, 3 or more times a week.
So for the salmon, if you're going to eat fish and try and make that your main source of omega-3s, it's a every other day kind of consumption, I would say, or very big servings.
Yeah, kind of a good size, say 100-gram serving of salmon might have 1,000 to 1,500 milligrams of EPA and DHA. So you'd need to eat that every day.
Okay, so that is actually, so it's 100 grams of salmon each day.
Yeah.
Is that like the up for the kind of the optimal?
Sure. If you want to pick a fish, I mean, you can mix it up and have sardines and mackerel.
Yeah.
But if you just talk about salmon, one good size serving of salmon every day would give you about the amount of omega-3 you need to get a healthy level.
All right, that's a lot of salmon.
Yeah. There's also the caveat. I don't know. There's a caveat of if you've consumed fish regularly your whole life, how much, because there's a difference between trying to catch up and you have low levels and you're trying to get them high in a short amount of time versus a lifelong intake. And we aren't totally sure how those doses differ. Most of the data that we have is on people who were low and then are taking a high dose to get higher levels. So if you've eaten, so in Japan, for example, their intake is 800 to 1,000 a day, and they typically eat it every day, every other day. It's part of their daily diet, and their average blood levels are about 9%, and that happens for their entire life. And so those kind of examples are where we have to look to for how much fish you would need to eat and how that would relate to their blood levels over a lifetime.
Let's head over to supplements then. Like, what are your thoughts about supplements?
They are a useful tool. They are a potent source of EPA and DHA, for sure. The big thing with supplements is you have to know what the dose is that you're taking. So making sure you look at the back panel and seeing how many capsules there are per serving size, and then how much EPA and DHA specifically are in each serving size. I think that's where most people get tripped up is they might think that it says it's 1,000 milligrams of fish oil, but there might only be 300 milligrams of EPA and DHA. And so it's really important to know how much EPA and DHA specifically you're getting. And that you can see on any supplement. It'll be on the back panel.
All right, interesting. And for a grown-up, what would be the optimal dose of DHA and EPA per day?
I'm going to caveat it again and say it's based on your blood level. But we would, on average, for the U.S. is where we have most of our data, and it looks like about 1,000 to 1,500 milligrams will get most people up around 8% blood level over within like 4 months, essentially.
Okay.
That's a decent dose, and it's higher than a lot of people might think. A lot of the recommendations are a lot lower, and those are usually based on more epidemiology studies and dietary intake studies.
Right. And it will also be very interesting to know if there's a safe upper limit you can take per day.
Yeah, in the US, the FDA set the limit at 3,000 milligrams a day. I believe Europe EFSA has said 5,000 milligrams a day. The pharmaceutical doses are about 4,000 milligrams a day. and they have been shown to be safe. So you can get pretty high without any side effects that we've seen.
What if you would take like 15 grams a day for, let's say, half a year?
Well,
That'd be tough.
I don't think anybody's done that. We did studies back in the 80s, 90s, giving 6, 7, 8 grams a day for 2 or 3 months, and no harmful side effects. But we got nice triglyceride levels lowering. That's what we were studying in those days. So that's safe. It's just not very practical. There's a huge amount of work that has to be done on high doses above 3.5 grams of EPA and DHA. The standard pharmaceutical dose is 3.5 grams EPA DHA. And we don't know very much at all about what 5, 7, 10 grams a day does. It may be very helpful in some disease conditions, but you're totally into a medical model then. I mean, this is not nutrition anymore. You can't eat that much in natural foods. It's just, you can't do it. So you have to use supplements for that.
All right.
Or farm products.
All right, but so it's safe to say that 5 grams a day, there is no side effects at all. That's really a safe upper limit.
That's a very safe upper limit, and the rest of it above that is just unknown.
Okay. Yeah. Can I ask you just what you think? It's just interesting. I'm not saying that anybody should go out and eat, go out and eat 15 grams a day, but it's just interesting to see, like, because my impression is that omega-3s are very safe. That's why I'm asking.
Yeah. No, I'm just looking back at some studies we did. We gave 25 grams a day of EPA and DHA to healthy volunteers for a month with no side effects.
Okay, interesting.
So, but that's, I think the safety is not an issue with omega-3.
Right. Yeah. That's very, very good to know. So it's perfectly safe to take a dose of 2 or 3 grams a day or day then. Okay.
Yeah.
Okay. Right. Yeah. Interesting.
And the big thing with safety that most people are concerned about is bleeding, and kind of like we said before, blood flow and reduced blood clotting is probably one of the main ways omega-3s are benefiting so many parts of our body. But then there's kind of this thought that taking or having really high omega-3 levels, taking too much will increase your risk for bleeding. If you cut yourself or if you're in surgery, you will just bleed too much and never stop bleeding. And that is not the case. We've written some papers here looking at all kinds of different studies and different scenarios where bleeding might be an issue, and there was not an increased risk of an excessive blood loss situation or a dangerous blood loss situation in people who were taking omega-3s or higher omega-3 level.
Interesting. And also, when it comes to different supplements, do you have any recommendations of supplements that are better than others, or?
We typically stay away from recommending specific brands because we look at blood levels, and so a lot of different brands want to see how their supplements work, and we'll test their blood levels, and so we're a third party company for them. So we don't recommend any brand, but we always say make sure you know what you're getting, know what your dose is. We have a calculator on our website that can help you estimate how much EPA and DHA should work for you based on your baseline blood level. And so from that, you can go and look and see, you can get really concentrated supplements. Those are typically more expensive. You can get liquid supplements. It really depends on how much you want to pay. Are you comfortable taking large pills? Are you comfortable swallowing lots of pills? Those are all kind of personal decisions, or the environmental effects of that company and how they source their fish oil. Those are all really personal decisions. But our main focus is making sure the dose is right and you are aware of your dose. And so using the calculator on our website and then using that to do your own research and find a good supplement for yourself is important. And the other thing with supplements is take it with food almost always, if you can.
Right.
Take it with a fat meal, because that will help. Every supplement, every type you take, it will help you absorb the omega-3s in that supplement better if you're eating food and taking the supplement with it.
Perfect. So when you're taking a supplement, then you're supposed to take it with food. Is there anything else that you should think about when taking your supplements?
Food with a fat meal is the best, because you're trying to absorb fat. So if you have a meal with fat in it, your body is more ready to absorb it.
Yeah.
I think that's the big thing.
Yeah. Other than that, whether you take it once a day or twice a day doesn't really make much difference.
Mm-hmm.
Okay. So with food and then eating it with something that contains fats is also good then.
Yeah.
Okay, interesting. I also heard that you're supposed to have your omega-3s in the freezer. Is that true?
That's kind of an urban legend.
Okay.
I mean, it's not totally illogical, because, but it's never really been tested to say that to keep down the fishy burp for that purpose. I mean, that's usually why people say to do it, is so you don't get a burp.
Right.
And I don't think. I mean, if you really think about taking a pill out of the freezer, so it's frozen essentially, and then you put it in your stomach at 98 degrees or 37 degrees for you guys.
Yeah.
How long is it going to take a pill to actually thaw and melt? Pretty fast.
Yeah.
So it's still potentially going to break open. You get burps from fish oils when the fish oil is dissolves in your stomach and your stomach doesn't empty its contents very fast. It's what's called slow emptying time. And then, so it stays in the stomach and then it burps up. If it goes all the way through into your small intestine before it opens up, before the pill dissolves, then you wouldn't have any burp.
Right.
It's past the stomach.
I was thinking, but there's so there's nothing about like the omega-3s. They don't go bad if you keep them in normal room temperature.
No.
Okay, that's good to know. I will get my omega-3s out of my refrigerator then.
Yeah, it certainly doesn't hurt to keep them there, or the refrigerator. But you don't have to.
Okay, so also having them, so having them in normal room temperature is the way to go.
Yeah.
Okay, so it would also be very interesting to know about measuring omega-3. So what is kind of the best way to measure your omega-3 levels?
Well, we developed a blood test about 15 years ago called the Omega-3 Index, and that is it's a measure of omega-3, EPA, DHA in your red blood cell membranes. So, your blood is sort of 50% plasma or water and 50% red blood cells that carry the oxygen around. So we measure in the membrane how much EPA and DHA is there, and we express it as a percent of all the fatty acids in the membrane. And so it's typically somewhere between 2% and 10 or 12%. That's EPA and DHA. And that metric is a really good marker of your whole body omega-3 status. And we can do that test on a regular drop of blood dry it on a card, or we can do it on a tube of blood. But that's the test we offer, is the Omega-3 Index.
And that is also the test that's been used in a lot of scientific studies, right?
Yeah.
Correct.
Right.
Yeah, so that, I mean, that says something about the quality of it, of course. And so you mentioned it a little while back, but what is the optimal levels then when you take this test? Like what could you tell us a little bit about the different levels?
Yes. So our desirable range is to have an omega-3 index between 8 and 12%. And typically we see in the US, average levels are 4 to 5%. In other fish eating cultures, they can average in the 8 to 12% range. So that was really based on the heart disease literature, and specifically for sudden cardiac death, so heart attacks with almost no forewarning. And they found that people who had higher blood levels of omega-3s were at less risk of having those kinds of heart attacks. And that was replicated. And then, and so it was an idea to go ahead and say the omega-3 index, the amount of omega-3s in your blood, is a predictor of this, and we should measure it in people. And then we can change it with diet or supplements and reduce the risk of having those kinds of heart attacks. And since those studies, that was proposed in 2004 by Harris and Von Schacke. And then since then, it's been validated in other cohorts and for other types of diseases too. So recently there was a study that pooled 10 different studies together and asked whether that 8 to 12% is actually a good target level for heart disease. And they found that it being in that range was reduced risk for heart disease by about 30% compared to being at 4% omega-3 index. So having a higher level versus lower level did reduce risk for heart disease. So it's been confirmed in recent studies. And so that's really where that range comes from. It's based on research that we've done. We use the same methods as we do in our research studies as we do with our clinical commercial samples that we measure every day. So we think that's an important piece, is that your level means something when it's measured as the omega-3 index from Omega-Quant.
All right. So if you have 8% or more, then you're in the kind of the optimal range. And if you're lower than 8%, then you don't have, then your levels are not really that good.
Yeah, correct.
Well, yeah,
it's a spectrum, of
right.
course. The 4% was really that low. Being less than 4% is kind of the bad zone. When you're in between 4 to 8%, which a lot of people are, it's intermediate. Being at 6 is better than being at 4. Being at 8 is better than 6, but it's not like it's a sliding scale. And so the 8 to 12% is a nice goal to have, but being at 7.5%, it's still good.
Yeah. Okay. So 4 then it might not be the best. 7.5% of course is a lot better, right. but having 8 or above is kind of the best.
Yeah.
That's your goal.
That's the goal.
That's the goal. All right. Interesting. Okay. So how does it work? I haven't taken a look at this myself. How does it work? Like if you wanna test your omega-3 levels, what do you do? Like how does it work?
Yeah. So from our company, we have a dried blood spot technology where we can measure essentially the omega-3 index and a red blood cell membrane from a dried blood spot. So we basically have these little kits that can be done at home, and people can order online at omegaquant.com, and you can pick from several tests that we have that are all fatty acid based tests. And we send you a kit. You open it up. It has a little baggie, contains a lancet and Band-Aids and gauze. And essentially you just wipe your finger, prick it with the lancet. So you have a drop of blood form on your finger, and you drop that onto filter paper that's been treated with an antioxidant mixture. And that maintains the fatty acids in the blood so that it can be dried. It can be sent through the regular mail once it's dried. And that just comes back to our laboratories. And we are able to analyze the fatty acid content of that blood and get the omega-3 index from it. So it's a really, it's a great system. It's been used in research for years and years. And it's very, very easy to do.
I was giving you the question that like which supplements are the best, but I guess like if you buy a supplement that seems to be good on Amazon, for example, and you take it for a couple of months, and then you can just take the test, and then you know if the supplement works or not, because if you're 8% or higher, then you are in the good range, right?
Exactly. You're actually able to see if what you're spending money on is working.
Yeah. Personalized nutrition.
Mm-hmm.
Yeah. No, but it really is quite good, because I myself, I find it very hard to know, when you go out on Amazon and try to look at different omega-3 supplements, for example, there's hundreds of them, and it's really, really hard to know which one is working. So I try to, you look at reviews, try to look if there have any like studies on the webpage and stuff. But still, it's quite hard to know if they're actually working. So actually doing a test really makes sense after a couple of months to see if you're up in the range that's where you want to be.
Yeah, and we're starting to work with some different brands who want to be able to say, basically do a research study and then put the results on their webpage. Say, yeah, we've studied this. People who take 2 capsules of our product a day for 3 months have a 80% increase in their omega-3 index. And that would be great marketing for them. But you need a biomarker like that to tell you it's working.
Exactly. Yeah, I totally agree. That, I mean, if that was something that the companies would show on Amazon, for example, then that would give a lot of credibility, right?
Yeah. And even when they do show that, there is individual variability. So you might need more than the next person, and they might need, it does matter. There are some things that are unexplained why one dose works for one person and is not quite enough for another person. And so that's where testing yourself is really the best thing to do. Because even some of these studies they run, it might just be 20 people and might get a good response, but there is individual variability. So really the only way to know is to test yourself. And the other thing is it takes about at least 4 months to reach kind of a steady state. So you wouldn't want to test before 4 months because your blood levels are still going up, and they can continue to go up after that as well. But if you go for 4 months on one dose and it's not as high as you want it to be, but it's increased, then you might need to increase your dose a little bit and then retest again.
I think that is pretty much it. Do you have any other things that I haven't mentioned or that I haven't asked that you would like to mention before we end the conversation?
It's a good question. Nothing really leaps to mind. I think you covered a lot of territory, and I think it should be helpful to your listeners. We encourage people. The test that Kristina described is available in the United States, in Australia, and in Europe. It's got regulatory status in those places, so it can be ordered by a consumer and mailed to their home. Other countries, people can certainly order the test on our website and should be able to get it to them. It's just a little trickier in places like India.
Right, yeah.
But by and large, we just encourage people to know their omega-3 levels because it's something you can do to control your own health. And that's our usual take-home message.
Yeah, and I mean, as we alluded to earlier, when it comes to health, there are like a lot of things you can do, and it seems like omega-3 seems to be one of the top supplements that actually seems to work when it comes to a lot of different things, right? So I really think it's got the most evidence behind it, I think, of about any nutrient for a wide variety of chronic health conditions. Yeah, you mentioned that you can buy it in Europe as well. Like, if you would like to buy it in Europe, how does that work?
It's our website, omegaquant.com, OMEGAQUANT.com, and we have a lab in Scotland right now. So that's where the kits would be sent from and where they'd go back to. And
right. Okay. Interesting. Yeah. Great. It's really been nice talking to you both. It's always an honor to talk to somebody, or the two of you who really know a lot of this stuff. So big thank you for coming on and sharing your knowledge.
Well, thank you for having us.
Yeah, thank you.
All right. Take care.
Bye-bye.
Hope you enjoyed the episode. Friends, I really need your help. I'm trying to get the podcast out there. So I was wondering if you could help me by leaving a positive rating and a review on your Apple device or the podcast player that you're using, as well as subscribing to the podcast. That really helps getting the show more visible on iTunes and other players. And if you don't know how it's done, then YouTube has a lot of great videos, so you can search there. All right, that's it. Take care. This podcast is for general informational purposes only and does not constitute the practice of medicine, including the giving of medical advice. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment.